Hello, everyone. If you could hear me, please type it in the chat box. I want to make sure everyone could hear my voice. Great. Thank you for attending our FSA webinar. We'll start with a pre-recorded overview. Your microphones will be muted during the presentation, but feel free to type any immediate questions you have. Our representatives are here to help. After the presentation, you'll be able to hear your questions answered by our representatives, and let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Welcome to the City and County of San Francisco's FSA Open Enrollment. What is a flexible spending account? A flexible spending account is a pre-tax savings account that you utilize pre-tax dollars on eligible expenses. When you enroll in an FSA plan, you save on state, federal, and FICA taxes. This combined amounts up to about a 30% savings, which decreases your taxable income and increases your take-home pay. How does the plan work? Choose your annual election. Decide how much to set aside into your flexible spending account by estimating your predictable expenses for the upcoming year. Once you have determined this amount, you will enroll during open enrollment, and then your annual contribution amount is divided up by the number of paychecks that you have throughout the entire year, and is deducted on a pre-tax basis and loaded onto a debit card for your use. Here is an example of how the plan works. Say you elect $780 and you are paid on a biweekly cycle, which would be 26 paychecks per the year. That's $30 per paycheck that will come out pre-tax. There are two accounts that are available to you. The first is the Health FSA account. This account covers any out-of-pocket medical, dental, or vision expenses for you and any of your eligible dependents. The second account is the Dependent Care FSA. This covers the cost of daycare centers, after-school programs, summer day camps, babysitter services, and it can also be used for elder care facilities as well. The first account is the Health FSA account. This account has a full annual election amount that is available to you on the first day of your plan year. This is done purposely so that you do not have to wait for the account to stack up. Those funds are ready and available on the first day of your plan year. Once you are enrolled in the plan, you can only change your election amount if you have a change in family status or at open enrollment time. You do have a carry forward provision attached to the Health FSA plan. At the end of the year, you can roll over up to $640 into the following plan year, so long as you have a minimum of $10 remaining in your account. The carry forward provision does fluctuate year to year, and it is coinciding with the health maximum. So for this year, the maximum amount is $3,200. Therefore, the carryover maximum is $640. You do have a minimum annual contribution amount of $250, and that is an annual minimum contribution. Here are some examples for the Health FSA eligible expenses. Things like copays, deductibles, dental work, eyeglasses, over-the-counter medications are now accepted, as well as prescription medications. For a more extensive list of eligible items, please visit the FSA store. On this website, you'll find a lot of great tools and resources for eligible items. You can use it as a reference tool, or you can shop around on this website. They do often have coupons, free shipping. You can also visit the Amazon FSA store as well. All great resources so that you do not forfeit any funds once you get to the end of your plan year. The Dependent Care FSA. This account does have different rules with it. This is a pay-as-you-go account. What that means is you do have to wait for those funds to be withheld from payroll in order for the account to be funded. It is not front-loaded. You can only change your election amount if you have a change in family status or, again, at open enrollment time. This account is a use it or lose it account. Therefore, any funds remaining in the plan will not roll over. So you want to make sure that you spend down that account balance. You have a $250 minimum contribution on this account and a $5,000 annual household maximum. And this is a household maximum. It is not an individual maximum. Here are some examples of dependent care eligible expenses. After school programs, caregivers for disabled spouse or elderly dependents, daycare centers, day camps, so long as they're not overnight, elder care facilities, and nursing schools. The benefit card. When you enroll in the card, it is automatically activated upon first use. The debit cards are valid for roughly 3 years, and they do come with their own unique expiration date listed on them. If you are currently active in the plan for this year and you anticipate enrolling again for next year, please check the expiration date on your card. If it is not expiring, please make sure you hold on to it. If it is and you plan to remain active in the plan, a new one will be sent to you automatically. Should you need any additional cards, you can certainly order some free of charge right through your P&A account online, or you can call customer service or order additional ones through the P&A mobile app. How to submit claims. Should you need to submit a manual claim, you can do so through the mobile app, our website, or you can fax or mail a claim to us as well. Just some reminders, the health, FSA, and dependent care claims are due by March 31st of 2026. Reminder, any amounts between $10 and $640 into your health FSA will carry over into the next plan year. Any amount over that $640 will be forfeited. How to get reimbursed. Should you need to submit a manual claim and you need to get reimbursed, there are two options available to you. The first is direct deposit. You can sign up for this right through the P&A website. It is completely free of charge. The second option is a hard copy check. If you would like to get reimbursed through a check, there is a $25 reimbursement minimum before a check is mailed out. The mobile app. If you have not downloaded the mobile app, I would strongly encourage you to do so. You can register for various different account alerts. You can submit claims, check account balances, upload debit card documentation. And we also have a very useful feature on our app called the Easy Scanner. This scanner is great for point of purchase. So if you are in the store and you're wondering if an item is FSA eligible, if you open the P&A app, click the Easy Scanner, you can scan the barcode on the item and it will let you know if that item is FSA eligible or not. Here are a few snapshots from the mobile app. So you can log in using various different diagnostics. You have all of these different account alerts that you can toggle on and off. And then you can view various different direct deposit options, upload claims, you can order benefit cards. Again, the Easy Scanner is listed on here, so you can see a lot of different information and really customize the plan to work for you. Customer service. So these are our hours of operation. We are on the East Coast, so Pacific time, we are open from 5:30 a.m. to 7 p.m. We do also have live web chat on our website. And then here are our phone numbers listed as well. Should you need any further P&A and FSA education, you can visit our YouTube page and visit Penny the Panda. She is a great resource tool that goes more in depth about the accounts that are offered to you and some fun little tidbits about FSA in general. Thank you all for attending your FSA open enrollment hosted by P&A.
Okay, at this point, I'll check to see if there are any questions that we missed and our representatives can try to answer them. I think I see down here, the recent one is, are dependent activities like swimming classes and martial arts eligible for dependent care FSAs? And Victoria, you could also unmute your mic and
Yes.
yep,
Thank you. Yeah, I was typing as you were
yeah,
as you
thank you
had
for that.
stopped even. So yeah, so dependent care expenses, they are purely for daycare services. So martial arts, swimming classes, those are not eligible under a flex plan, whether you're in the dependent care plan or the health FSA.
Thank you, Victoria.
I just want to clarify because I saw a few people mentioned HSA. This is not an HSA plan. An HSA is a health savings account. We're referring to an FSA, which is a flexible spending account. So the question is, does the child care FSA also get taken out of our paycheck equally? Yes, it is. So any account that you enroll in is deducted on an annual basis and then taken out from each paycheck throughout the entire year. Can I use dependent care to pay my in-law who provides daycare for us? Yes, you can. The only caveat with that is the mother-in-law would have to claim that on their taxes. So in order to submit for reimbursement in that situation, we would require that person's social security number on the claim form. If you were going to an actual daycare provider, we would require their tax ID. However, as I mentioned, that person would need to claim that income on their taxes. If both you and your spouse work for the city, yes, you both can enroll in an FSA.
Sorry, I'm just going to make a correction. SFHSS doesn't administer FSA accounts for SFUSD. For that member, you'd have to connect with your benefits office at SFUSD, and it's the same for your dental benefits. We only administer your medical and vision.
Thank you for that clarification, Olga. Are there any other questions? Please just type it in the chat box.
And Victoria, this is Jessica. I have a clarification
Yes.
question. If a member signed their child up for an after-school program such as martial arts, would that then be covered because that's helping the member to continue to work during work hours?
For that situation, I would instruct you to call customer service. Typically, I would say no. I have never heard of a martial arts studio being accepted under the plan, but you can certainly call customer service. It's not considered a daycare service. Can I enroll in an FSA for the next year for 2025 for my account online by myself? You do not have to visit a representative in person. Actually, Jessica, maybe you can speak to how employees enroll for all benefits.
We have e-benefits and Olga can explain that.
Sure, I'll answer that one. So if you don't want to connect or submit an application through a paper application, you can go through eBenefits online. It's through the SF employee portal. Once you log into that site, under employee links, you will see right in the middle of the screen eBenefits and a link for open enrollment. You will then click on that link and follow the workflow. I believe if you're not making any changes to your medical, I believe it's the fourth or fifth question asks you if you would like to make changes to your healthcare FSA or your dependent care FSA. When you select yes to either one of those questions, the system is dynamic. And so what it will do is it will ask you how much you'd like to contribute for plan year 2025. And I believe it will also show you how much that means in your biweekly deductions. So eBenefits is a way to apply for your FSA benefits for plan year 2025.
Perfect. I see another question. I did drop the customer service number in the chat for anyone who would like it because I did see someone had asked for that. The maximum amount for the health FSA is currently $3,200. We don't know the 2025 FSA. However, you guys are you're behind because that does not get released until much, much later in the year. Concierge, I'm assuming you mean concierge at a hotel, maybe. That would not be covered either way. Domestic partners, you cannot pay domestic partners for childcare because they would be considered a dependent. If I'm going to elect to put more money during qualifying events, I'm assuming that I would be limited to maximum amount allowed by FSA during 2024. Is there any chance I can see how much more I can contribute? So you would be allowed to contribute up to the maximum. So whatever it is that you already have as an annual election amount, you would not be able to exceed $3,200. To see your account balance, you can log on either through the desktop website or the mobile app, and it'll show you your current available balance that you have. Just note that I believe there is only a 30-day window from a qualifying event to make that change. So I'm not sure when or if your change had already occurred, but just note that you do only have a short window of time to actually make that change.
And I just want to add one more piece of information on that. So the amount for 2024 contributions, so for plan year 2024 current year, is $3,050. For plan year 2025, it's $3,200. So if for this this employee, if you're asking about a qualifying life event to be able to contribute more into 2024's contribution, you're going to be limited to the 2024 rate, which is $3,050.
Thank you for that clarification. Vicente, I just have a new question here. Does preschool qualify for FSA?
So as long as it's not overnight, yes. Preschool usually is only during the day. Preschool would qualify under the dependent daycare FSA.
Thank you. And again, if you have any other questions, just please feel free to type it in the chat box.
I think there was a clarification for the concierge. It was doctor concierge services, not hotel.
Doctor concierge, I'm not fully versed into, I guess, that terminology of what that would mean specific to that employee. So it can be used for out-of-pocket medical expenses. So if you are seeking care elsewhere, maybe not taking the city's benefit, you can utilize this benefit. It's only for the out-of-pocket cost. So if you were picking up another plan that was being withheld pre-tax for your premiums, you would not be allowed to use an FSA to pay for those because they're already taken on a pre-tax basis.
And just catching up on the questions here, I think the next one was, if you can add to your 2024 FSA, can you also reduce the FSA for 2024?
So now this is only pertaining to a qualifying event, just to clarify. You can only change an FSA if you have a qualifying event. You can also reduce. So if you have a qualifying event, you can either stop, pick up, reduce, or increase your FSA election. Dental implants would be covered. It's for out-of-pocket medical, dental, and vision expenses. I said, is the amount of out-of-pocket we are paying for PPO services like an MRI covered? Yes, so your out-of-pocket costs are covered. Rollover amounts. Sorry, that was during the presentation. This year, so Jessica, are you guys, you're sticking with the year behind at 610?
That's correct, yes.
Yes. Can I claim both dependent care FSA and child tax credit at the same time, or whichever is the maximum? Yes. So if you have a single child, the tax credit, you're going to be better off contributing to the full maximum of the dependent care FSA. When you have 2 children or more, the tax credit exceeds that dependent care maximum through the FSA. So when you have more than 2 or more children, you can seek both reimbursements. If you only have one, it's whichever you prefer. If you'd want to take the tax credit or if you would want to utilize the FSA for those. Invisalign is covered through the FSA under the dental. Qualifying events would be marriage, divorce, death of a dependent, or the birth of a child. Those would allow you to make a change to your FSA. I guess I'm not understanding this last question. If charge per doctor is more than copay per plan, is it covered? I'm not understanding what what that question is referring to. To clarify, can you change dependent care contributions during the year based on need? If you enroll in an FSA plan, no matter which plan it is, you are locked into that annual election amount. It cannot be changed unless you have a qualifying event. For dependent care, there are special nuances that go into effect with that. So, for example, if you were working full time and your hours at work were reduced, that would be a qualifying event to change your election amount. If you were to move and your existing daycare provider is over a certain mileage away from your new home, that is also considered a qualifying event. However, when you enroll in any of the FSA plans, you are locked into your election amount for the full year. So please be conscious that you're utilizing either plan for predictable expenses. And just a reminder, the dependent care account does not roll over. That only pertains to the health FSA.
All right, any other questions? Please type them in the chat box, please. Are there any additional questions? Yes, the recording should be ready by next Monday. And Alice is reiterating the question before, charge per visit is more than copay allowed in a health plan. So is the amount greater than the copay allowed?
I guess I'm not understanding your charge per visit. I mean, you should be paying the copay. So if this is in terms of a specific claim, I would call customer service, because without knowing full detail of what it is that you're referencing, I wouldn't be able to give you an answer.
And again, I'd like to ask if you have any questions, other questions, just go ahead and type them in while our representatives are still here. Going once, going twice. Okay, well, seeing none, that wraps up our webinar. We strongly encourage you to invite your colleagues to participate in these webinars so we can address as many questions as possible. Thank you to our representatives for sharing your knowledge on these subjects, and have a wonderful day. Thank you.
Thank you all.